Welcome to part 3 of the CT trauma lecture series. We have already seen in the previous an introduction of CT of trauma. We saw subdural, epidural, and subarachnoid hemorrhages, which are the 3 extraaxial hemorrhages. Welcome to the next part of it, which is part 3, where we're going to see kind of different entities. We're going to start, of course, with our oddball case. I always start with something that looks like something else. So here we have a case where we have increased density around the frontal lobes with low densities, edema in the frontal lobes. Edema, it's only in the white matter, so this is typically vasogenic edema in a patient that had trauma. So we saw this patient and we said, this patient very likely has contusions in the parenchymal lobes. He was found falling down with some very possible subdural hematoma. So when you saw that, we thought it was parenchymal contusions. The frontal lobes suffer a lot with hemorrhagic contusions just because the roofs of the orbit are corrugated and they're very irregular. So when you have the brain is shaking, it just likes to break down and tear down the inferior aspect of the frontal lobes. And that was what was thought in this case, that it was parenchymal contusions, that we had some subdural hematoma, or it could also be an infection. Remember, in the previous lecture, we showed some meningitis because of tuberculosis. So we did this, the study we did, this is a T2 flare. So T2 dark white matter with dark CSF. You see the lesions in the frontal lobes. Then the CT, we already know what it showed, but when we added contrast in the T1 with contrast, look at that enhancement. It enhances almost like a meningioma. Remember that those meningiomas we've been looking at? And we did a biopsy. We didn't know what it was, and this ended up being one of the histiocytosis. This is one called Rosai-Dorfman. They look and they give you these images. But of course, that was the oddball. Let's go really to the ones that we wanted to talk, which are the parenchymal hemorrhages. So parenchymal hemorrhages are hemorrhages that actually happen inside of the parenchyma itself. They're commonly seen in the frontal lobes, especially inferiorly in the poles, where the convexity of the hemisphere hits the skull, or also in the temporal lobes where the same thing happens. Because of the skull ridges, remember that you can have them in the inferior frontal lobes. These are the ones that are in the frontal lobes that are very, very frequent. Patients that have trauma, you see all of the heterogeneous the signal densities in the frontal lobes, and you have huge bleeds that have an extraaxial but also a parenchymal component. These are parenchymal bleeds, and we can call them parenchymal hematomas. And these are the bifrontal ones. They can be big like that, or they can be slightly smaller than the one that we're showing in this case, where they're just a little bit smaller. They're very nicely seen in the coronal views. So these bilateral frontal contusions are in close proximity to the inner table of the skull. They typically will exhibit these hemorrhages, and you can also have vasogenic edema, like in the case I just showed you. This is how they look when they happen in the temporal region. They happen very close to the temporal poles. Now, when we're talking about parenchymal contusions, there's a concept that is very important in high yield, and it is the coup and contra coup injuries. The coup and contra coup injuries happen when you have a very fast acceleration and deceleration phenomenon. So how could that happen? Imagine that you're falling and you fall and you hit the back of your head. When you hit the back of your head, your skull is in contact with the floor, say when you fell, but your brain is kind of bumping because of a contra coup effect with the frontal region of your brain. So when that happens, you're going to have a posterior injury, which is kind of where the skull contusion will be, but directly opposite to it, you can have a parenchymal contusion, and that's what we call a coup contra coup. And it can happen in multiple directions. It can happen from left to right. It can happen from posterior to anterior, and in any direction. It can be oblique. So this is a case that we have here where you have a temporal lobe lesion on the right side. This is a T1 MRI, and the hemorrhage is white, so it has to be in the first month of the hemorrhage. But if you go back towards the other side, you see that there's an extraaxial fluid collection in the subdural space in the opposite part of the head, right? This is what we call a coupe contra coupe. It happened because of acceleration, deceleration. The contusions are at the site of injury in the opposite side. The coupe, which is the one that hit the floor, say, the direct hit, usually is associated with skull fractures, and skull fractures are associated with epidural hematomas, while the contra coupe is usually a parenchymal hematoma because of how the brain parenchyma hit the inner skull. We see them like this a lot. So you have these two CTs. You see that the scalp has a big hematoma in the right parietal region. And if you imagine that it hit there, you have to look what happened on the opposite side. And in the opposite side, there's a parenchymal hematoma in the frontal region. So if you have that, where would you expect a fracture? Here or here? Correct. Here in the coupe. This is where it happened. So the coupe region is the one that has the fracture and associated with the epidural hematomas. The one with the parenchymal hematomas, which look much worse, is the contra coupe, which is in the opposite side. Right? This is a 58-year-old patient, yes, female, that came, and she had a coupe injury here. You see the subarachnoid hemorrhage right there, right? And you go to the other side, and you see the parenchymal hematoma of the contra coupe lesion. So this is just to tell you, every time I see kind of an injury, I go to the other side to make sure that I'm not missing a contra coupe lesion, right? I guess this is the last one I'm going to bring, but you see it on the opposite side. It happened here on the left side. You go back and you see the big parenchymal hematoma right across in the frontal lobe. So if you're going to look for a fracture, you look for the fracture here or here at the coupe site, and you can really see the fracture there. So this is a fracture injury in a coupe contra coupe injury. So parenchymal hemorrhages can also be dated, very similar that we did with dural, epidurals, and durals. I think that you have to be careful depending on the compartment that you're looking at to date with MRI, but they basically follow the same hemosteric dynamics that you saw with the other hematomas. Maybe the biggest difference is when you have an intraventricular, that the hemorrhages intraventricular don't behave the same because of the fluid dynamics inside of the ventricular system. So differential diagnosis are focal parenchymal contusions. Hemorrhagic venous infarcts can also be parenchymal and have a hemorrhage, a mass that hemorrhages, or an abscess. So this is a trauma, and the patient had a parenchymal hemorrhage. You can see the parenchymal hemorrhage right back here. It's really tough to know when it's a parenchymal hemorrhage. How do you know there was not a mass that bled? It's almost impossible sometimes if there's not a history of trauma. So we wait for the hemorrhage to improve, and then we do an MRI to make sure that it was not a little mass that was hurting the patient. Or patients that have venous thrombosis can have hemorrhages just because of the venous stasis. And if that happens, you can confuse them with parenchymal hemorrhages of trauma. So that's kind of the differential diagnosis for this one. Well, with this, we finalize the part 3 of this lecture where we spoke about parenchymal hematomas.